Hello and welcome to Dr. Joe, a medical program where we discuss various health issues affecting humanity at large. Today, we are going to be discussing breast cancer. Remember, we are in October. It is Breast Cancer Awareness Month. What exactly is breast cancer? Breast cancer is a malignancy of the breast tissue. By malignancy, what do we mean? It simply means cancer. What exactly is cancer? Cancer occurs when there is an aberrant growth of cells. Essentially what happens is normally your cells should grow in a way that is controlled by your body. For example, in a day you shed or you lose millions of cells. Yes, millions of cells die in your body on a daily basis. But now when you've got cancer, what happens is your body is not controlling that death of cells. At times a billion cells die and a million cells are also remade or regenerated. But now when you are suffering from cancer, it means the rate of death of those cells has been reduced. What exactly am I trying to say? It means if you are losing a million cells a day, then when you've got cancer, instead of losing a million cells, maybe you lose 500 cells, 500,000 cells, then you still remain with an extra 500,000 cells, and your body makes another million cells. And the remaining cells are no longer controlled by your body in terms of growth. They are now growing in a way that is not controlled by your body. That is rebellious growth. So when those cells that are rebelling against your body start growing in a way that is uncontrolled by your body, it means they become cancerous. Once they are cancerous, what happens is they start growing, and that's when you start feeling lumps and growths. We call them tumors. But there are some tumors or growths that are benign, but there are those that are cancerous. Like today we're focusing on breast cancer. That means they are cancerous cells. So essentially you'll be having cancerous cells or cells that are rebellious growing in your breast tissue. Now let's look at the breast tissue. The breast tissue is made mainly of two parts. There are two parts of the breast that are most important when it comes to cancerous growths. One, we talk of lobules. Lobules, this is the part of the breast that is dealing with making of the milk. That's the lobules. So when you get cancer in the lobules, we call it lobular carcinoma or lobular cancer. Two, you've got what are called ducts. Ducts, these are like tubes that will be carrying milk from the lobules to the nipple for the breast, for the baby to suck the milk out. So when you get cancer in the lobules, we call it lobular cancer. Just to recap, we've got mainly two types of cancer. They are not the only ones. There are several types, but these are the key ones. One, lobular cancer, it affects the lobules. The lobules are the parts of the breast that make the milk. Then two, you've got ductal cancer. It affects the ducts, which is the part of the breast that carries the milk to the nipple. Essentially, those are the two main types of breast cancer. Now, let's look at the prevalence of breast cancer. We say worldwide, breast cancer is the commonest cancer in women. What do we mean by that? Let's say there are whatever number of women are suffering from cancer in the whole world. Breast cancer has got the highest number of cases amongst those. For instance, in the world, we've got 25% of all cancers being breast cancer. That means 1 in 4 women with cancer got breast cancer. That's how prevalent it is. In terms of exact figures now, it affects more than 2.2 million women annually. And then when it comes to mortality, that is the number of patients or people that are dying from breast cancer. Every year, 523,000 people are dying from breast cancer annually. That's a huge figure. 523 people dying from breast cancer annually. The reason why I want you to know these figures is you can prevent breast cancer. There are certain types of cancers that you can prevent. You will see when you go further to look at the risk factors of breast cancer. For now, let's take a commercial break and come back and discuss the risk factors of breast cancer. Welcome back to the second segment of Dr. Joe. Today we're focusing on breast cancer. We've talked about what exactly is breast cancer, and we've gone a bit further to try and elaborate what exactly cancer, how exactly cancer develops. So now I want to focus on the risk factors of cancer. What are the risk factors of breast cancer? One, we talk of hormonal risk factors, then we also talk of other social risk factors. So let's talk of hormonal risk factors first. The hormonal risk factors are one, we call it parity. Nulliparity, it means you've never had a child. If you've never had a child, your chances of developing breast cancer are very high. So generally, people that have never had a child have got a high risk of developing breast cancer because the estrogen levels are usually high in those patients that have never had a child before. And those that have had a few children, maybe 1 or 2, they've also a higher risk of developing breast cancer. Then 2, we talk of early menarche. By early menarche, what do we mean? Early menarche means you are having your period, you start having your period at an early age. Usually if you have your period before the age of 10, your risk of breast cancer is actually higher than someone who started their periods later on. And people who have early menarche and late menopause, that means you start your period early and have your period and finish your having your periods late. That's late menopause. If you've got early menarche and late menopause, you're exposed to estrogen, higher levels of estrogen than people who've had normal menarche and normal menopause. So early menarche, having your periods early, late menopause, finishing your periods late, increases your risk of breast cancer. So those are the main hormonal factors. And then from there, we look at sex. Yes, sex. It means that if you're a woman, you've got a higher chance of if you're suffering from breast cancer. Actually, say you've got 100 times higher chances of suffering from breast cancer. And yes, believe you me, men also are affected by breast cancer. We say men have a 1% chance of suffering from breast cancer, but most of the cases that we see are female breast cancers. So it means if you're a female, you've got a high chance of suffering from breast cancer. Other factors, age. If you're elderly, your chance of suffering from breast cancer are high. Usually it affects people that are 50 years of age and above. It's rare to find someone who's below 50 suffering from breast cancer. Yes, there are cases, but mainly 50 years and above, your chance of suffering from breast cancer are increased. Then from age, there are social factors. These are the factors that I want people to learn so that they reduce their chances. 1, if you are a smoker, it means your chances of suffering from breast cancer are quite high. So I encourage people to quit smoking. If you drink alcohol, your chances of suffering from breast cancer are also higher than someone who doesn't drink alcohol. If you're obese, you're overweight, your chance of suffering from breast cancer are also high. If you've got high cholesterol levels, you eat a lot of fatty foods, your chance of suffering from breast cancer are high. So I encourage people to lose weight and reduce and minimize the chances of suffering from breast cancer. And then the other risk factor, this one, unfortunately, there is nothing that you can do about it. If there is a family history of breast cancer, there is someone in your family who suffers from breast cancer or who suffered from breast cancer, your mother, your sister, your aunt, your chance of suffering from breast cancer are also elevated. So we call these genetic risk factors. Now that we've discussed the pathogenesis and the risk factors of breast cancer, I want to take a look at how do you screen yourself and see and know whether you've got breast cancer. One, the first thing that you have to do is to self-examine yourself. By self-examination, I mean you look at yourself and you examine your own breast and see whether you've got breast cancer or not. Before we go any further with this program, let us take a short while and listen to what a female doctor has to say about breast cancer.
Hello, Zimbabwe. My name is Dr. Takuzwa Chiwanga. I'm a specialist obstetrician and gynecologist based here in Harare. I'd like to take a few minutes to chat with you about breast cancer awareness. What can you do to prevent breast cancer? And how can you examine yourself? And how do you know if you're high risk? First of all, let's talk about the high risk factors. So if you have a family history of breast cancer, but not only breast cancer, but also colorectal cancer, endometrial cancer, as well as ovarian cancer, you're high risk for breast cancer. So if that is the case for you, then go in and see a healthcare professional and discuss those high risk factors and see if there's a way for you to be assisted, as your screening may have to start earlier than usual, and you'll also need to make sure that your breast examination is up to date. As for the general public, if you're a smoker or a drinker, this might be a good reason to consider smoking or reducing those habits, as they are significantly high risk for getting breast cancer. The other thing that you can do is examine yourself as from the age of 18 monthly, and we'll quickly work through how you can do a breast self-examination. So to examine your own breasts, you can, if you're premenopausal, that is if you're still having your periods, you can examine your breasts 3 to 5 days after your menstrual period has finished. So what you would do is you inspect, which is to look in front of a mirror, And then after you inspect, you then have a feel of your breast. So it's important that you familiarize yourself with how your breast normally feels. So if it's the first time you're examining yourself, you can examine yourself as well as have a healthcare professional examine you to make sure that your initial examination is normal. So in terms of inspection, you'd stand or sit in front of a mirror and have a look at your breast. So you have a look at your nipples, see if your nipples look as they would normally look. So if your nipples would normally look outwards, sometimes they can look inwards, what we call inversion, which can indicate that there's an abnormality. You may also notice a discharge from your nipples. A discharge in terms of cancer can be clear or blood-stained. Except for those, of course, who are breastfeeding, in which case we'd expect you to have some discharge for your breast, which is usually breast milk. And also if you're pregnant, you'd expect to have some discharge from your breast as well. But apart from that, you should not have a discharge coming from your breast. So after you have a look at your nipples, you can have a look at your arms. With breast cancer, you might have asymmetry. That means that one arm might grow to be more swollen than the other. Then you also look at your armpits. You check if there are any obvious swellings in your armpits, which can be an indication of breast cancer. Of course, if you have a chest or a throat infection, you may also have lumps in your armpits, which may not actually mean that you have breast cancer. So always, if you find an abnormality, go in and see a healthcare professional so that they give you an assessment of what's going on. So we've inspected our armpits and we've inspected our upper arm. Now we move on to the breast itself. It helps to divide your breast into 4 sections. So imagine a line all the way down through your nipple from the top to the bottom, and then another line across through your nipple. So we want to make sure that we examine all 4 of those areas, and you'd use the palm of your hand to do so. So you feel from about 3 centimeters below your costal bone all the way down to where your ribs come to an end. So that entire area is your breast area. So you use the palm of your hand, like I said, and then you make small circular motions using your chest as a background. So you do your small circular motions all the way. You make sure you've done 1 quadrant, which will be the middle. Then you do the outer quadrant. When you do the outer quadrant, remember to also go all the way into your armpit. And then you do the 2 lower quadrants. So you have a feel while you're seated or standing. And then once you're done having a feel while you're seated or standing, you can then have a feel while you're lying down. So while you're lying down, you have a better base in terms of moving your hand against your rib cage. So you have a feel again while you're lying down. And then once you're done having a feel in all 4 quadrants, what you can do next is actually have a little squeeze. I know that sounds funny, but really you're checking again for abnormal discharges from your nipple. So you'd squeeze your nipple, squeeze your breast a little bit quite gently, and then you see if there is a discharge. So again, you're done with your self-breast examination. You do this monthly. If you're premenopausal, 3 to 5 days towards the end of your period. If you're postmenopausal though, what you'd need to do is to just choose a day of the month where you do your self-examination. So that would mean you can choose, say, the 15th or some day that has some significance to you so that you don't forget. So once you've chosen a day that's appropriate for you, you do your self-examination monthly. From the age of about 40, you may also need to have a mammography. But again, if you're high risk, your screening might start earlier. So let's make sure that we take care of ourselves, because in order to take care of others, we need to take care of ourselves first.
Let's draw further into the signs and symptoms of breast cancer. 1, breast cancer is generally painless. By the time you feel pain, it should have advanced. And usually there are no ulcers. By ulcers, I mean wounds. At first, there are no wounds. Once you get wounds, it means breast cancer is now advanced. So the main symptom that you get is a breast lump. Most patients present with a breast lump. We say 80% of all breast cancer patients present with a breast lump, but there are a few that present without a lump. If you present without a lump, you could be having, we will talk about this when we talk about the staging of breast cancer. It's called carcinoma in situ. So now, before we go any further, let's take a short break and come back in the 3rd segment and discuss the management and the diagnosis of breast cancer. Welcome back to the 3rd segment of Dr. Joe. Today we're discussing breast cancer. Remember how to make a diagnosis of breast cancer is essentially and purely from laboratory tests. We do what is called a biopsy. We take what is called a tissue biopsy. There are two main ways of taking a tissue biopsy. One, we do what is called an excisional biopsy. Two, we do what is called an incisional biopsy. An excisional biopsy, we do it with a small lump. We take the entire lump, then we remove it, then we send it to the lab. Then it is the pathologist in the lab that is going to tell us whether the lump is cancerous or not. So if it's cancerous, it means you've got breast cancer. If it's not cancerous, you do not have breast cancer. That's one. Two, we do an incisional biopsy. We normally do an incisional biopsy in lumps that are actually big. With a big lump, you can't just excise it at once. At times, you want to go in and take a small segment of the lump, then you send it to the lab. Then when the lab tells you that this is cancer, you might need to go on and prepare to do a bigger operation. And then, after we do that biopsy, what is then needed after that is staging of the breast cancer. We stage breast cancer from stage 0 to stage 4. Stage 0 is what we call carcinoma in situ. This is a cancer that you can't even feel. The lump, you can't even feel it. Usually it's just cells inside there that you can't even feel. Normally these ones you get them maybe from a mammogram, then you make that diagnosis. Then from stage 0 go to stage 2. Stage 2 is a breast cancer that is just limited to the breast, and it's a small lump, usually it's less than 2 centimeters. There are three main parameters that we'll look at when you're making a diagnosis or a staging of breast cancer. One, the size of the tumor. If it's small, it's usually a lower grade. It's a low stage. If it's bigger, the stage is also greater. Then two, we look whether there's involvement of lymph nodes. You remember when we talked about examination, we said you look at the axillary or armpits lymph nodes and lymph nodes above the collarbone. So you look at those lymph nodes as well as part of staging. Then the third thing is distant metastasis. Is the cancer spread? If the cancer is spread, we say there is distant metastasis. And usually those come with worse grades and poor prognosis. Now, stage 1 is a cancer that is just less than 2 centimeters in terms of size. There are other factors like the lymph nodes. We won't talk about them. Then stage 2 is a cancer usually between 2 and 5 centimeters. Then stage 3, a cancer that is above 5 centimeters. Stage 4, whatever size of the cancer which has spread distantly. If the cancer has gone to other organs, and the common sites of spread are the liver, the lungs, the brain, and also the pleura. So if the cancer is spread to any of those organs, and then it's already stage 4. Then when you've got what is called pud orange, you remember I talked about dimples in the nipple area that look like around the breast, that look like the skin of an orange. If you've got pud orange, usually it's advanced cancer. With those cancers, and if you think you've got any of those symptoms, please visit a healthcare service provider and get assistance. Now that we've staged breast cancer, let's move on to the management of breast cancer. There are mainly 3 modalities of management of breast cancer. One, it's surgery. You have to do an operation. If you've got breast cancer, we operate and we remove it. The earlier, the better. That's why we emphasize on screening tests. Examples of screening tests that we talk about is a mammogram. You go for a mammogram, then you tell us there is a lump that looks like cancer, then you need to be operated on. We remove the lump. If you're fortunate to just remove the lump and the cancer is gone, that is what we call breast conserving surgery. We do an operation and conserve the breast. Then you go on with your life. At times the cancer has grown. We do what is called a mastectomy. Mastectomy is total removal of the breast. There is simple mastectomy and radical mastectomy. Simple mastectomy means we just remove the breast tissue without going to the axillary, lymph nodes and the other lymph nodes. Normally, when the cancer is still smallish, it's big enough, maybe between more than 2 centimeters, but still less than 5 centimeters, and it hasn't spread. We do a simple mastectomy, we remove the entire breast. Then from the simple mastectomy, we do a radical mastectomy. This is a more extensive operation where we remove the entire breast tissue, then we go into the axilla, we remove the lymph nodes as much as we can. Usually we do that in cancers that are a bit more advanced. So that's surgical management of cancers. Then on top of surgical management, you can do chemoradiotherapy. You can either do chemotherapy or radiotherapy on its own, or you can do adjuvant chemo and radiotherapy. Like adjuvant, we mean we do surgery first, and then after the surgery, we go on and do the chemo and radiotherapy. And then from those ones, since we said breast cancer is affected by female hormones like estrogen, there are drugs like tamoxifen that affect the hormone synthesis sequence or the functionality of the hormones in your body that we also use. So there's hormone replacement therapy that we also use, hormonal therapy, to treat breast cancer. So those are the three main modalities of treatment of breast cancer. So now that we've talked about the treatment of breast cancer, let's talk about the complications of breast cancers. One, we've got medical complications, then also have social complications. Medical complications that come with breast cancers, the cancer can spread, like I said, to distant organs and it would affect the other organs. That is if you delay seeking treatment. Two, it can ulcerate. You can get an ulcer, a wound. I had a patient some time ago, they came to us with a small lump. Then we told them we need to do an operation. They didn't believe us. They thought we were just saying it for the sake of it. They went home. They came back years later with a huge ulcer on the breast, and now they wanted us to operate on the cancer, but it was already too late. So please, when the doctors tell you that you need an operation, believe them and work with them well. Once they do a thorough investigation, mammograms, CT scans, ultrasound scans, and all that, and they tell you they need, and they take a biopsy, and they tell you they need to do an operation, please cooperate with the doctors and help them and let them do the operation. Because if you delay and you come back late, especially when you come back now, you've got an ulcer, there's a huge wound on the breast, there is nothing that the doctors can do. So that's one of the complications that we get. Then social complications. Imagine someone is walking around without a breast. That's a social complication. There is stigma and low self-esteem. Some people are not comfortable to walk around like that, and people will look at you in a funny way. So please, when you've got some problems like breast cancer, maybe post-mastectomy, after the operation has been done, seek help. There are prosthetic things that you can use, that you can apply, and you wear them, and you look normal. You look like someone who actually has a breast. So please, we do not want to stigmatize against people with breast cancer or people that have survived breast cancer. We should actually applaud them and support them and encourage them and work with them to help them to teach others so that others also get assistance in time. So for today, that is it that we have on Dr. Joe. Thank you so much for watching today's episode of Dr. Joe, where we discussed breast cancer. Let's meet again next week. We are going to be talking about cervical cancer. We thank you so much for watching, and please remember to like, subscribe, and share this video, and also like droptv.com. Thank you.